Deep into a crisis so many are comparing to war, what is the leadership our nation needs? Our Sunday morning cover story comes from senior contributor Ted Koppel.
Governor, it's great to see you.
Stanley McChrystal is a retired four-star general.
Okay, let's talk about where we are now.
Who, toward the end of his Army career, led the Joint Special Operations Command, Army Rangers, Navy SEALs, Delta Force, 7,500 of the most highly trained and lethal warriors in the U.S. military.
I think leaders have got to be brutally honest with themselves about what the real situation is and what they're trying to do. But then I think they have to be extraordinarily candid with their followers. One, it's a sign of respect. And two, it's just essential for long-term effectiveness.
Our adversary now is this virus.
Dr. Penny Wheeler is a gynecologist and obstetrician who now runs Allina Health with its 11 hospitals and more than 90 clinics throughout Minnesota and western Wisconsin. As president and CEO, Dr. Wheeler oversees a staff of more than 29,000 employees.
My job is to try to learn from them and get barriers that are creating barriers to their care or their growth out of the way. That's how I approach leadership. I sure hope I'm not a pain in the butt.
Here at Fordham, there is no I or me.
Father Joseph McShane is a Jesuit priest and the president of Fordham University in New York. In normal times, he'd be getting ready to preside over commencement ceremonies. These, clearly, are not normal times.
What more can we do? How can we be more present in a moment which doesn't allow us to be present physically? How can we be present to our people?
They may have little in common in terms of background and training, but each of them, warrior, doctor, and priest, is an accomplished leader. What do you think are the most important elements of leadership?
That's a tough question. I think you have to begin with self-knowledge. Number two, you have to know what your priorities are. Number three, you have to be wise enough to ask for advice. And four, you have to be humble enough to accept it. And if you are able to do those, you'll be a leader. Good leader, maybe. Great leader, possibly.
First of all, don't be in denial of what the true situation was and get the information from every vantage point you possibly can. The second would be learn as much as you can from the people who are the closest to the work. They will help guide your choices and decisions, and there's genius that exists out there that you need to listen to. The third is, collaborate as much as you can with others. Communicate.
I think first you have to care. You can pretend you care about the organization, the mission, and the people, but if it's not true, over time it will come out, and there will be a difference between what you say and what you do. I had a really bright lady come to my class at Yale teaching, and she gave me a quote I still use. She said, "People will forgive you for not being the leader you should be, but they won't forgive you for not being the leader you claim to be." So you got to be genuine.
There are really two viruses abroad in this country. The one is COVID-19 and the other is fear. And the fear can be almost as damaging as the disease. You're in charge. What do you do?
Well, fear is natural. And, I've been scared. I've been scared by the COVID virus here recently. So I think first admit that fear is not a sign of weakness. Fear is usually good sense. Now, fear shouldn't put us into inaction. What fear should do is it should be a motivator. It should be something that causes us to be more cautious, but not slower in the way we operate.
I had a doctor, Mr. Koppel, say that fear is an ailment too. Fear is an ailment. And what we want to do right now is do what we do best, which is to care compassionately with our expertise for the lives of others. There's a mentor of mine who once said that I think healthcare is more about love than anything else.
If you learn of some bad news, if you learn that things that you were expecting, let's say deliveries are not going to come, or if you learn something about the disease which is bad news, do you share it or do you hide it?
No, I think it's really important to be able to be as open about these things as you possibly can, appropriately contextualizing them for what it is. But we're trying to be very, very open about what we're seeing in the community, what our worries are in terms of having adequate protective equipment and equipment to care, adequate spaces to care for a surge that's anticipated. We need to share that. It's not to be an alarmist. If people experiencing something that is totally different from what you've said before, the trust factor goes down significantly.
Let me take you back to your military days when you were running Special Operations Forces. You would send these men and women out often on very, very dangerous missions. To what degree would you feel obliged to tell them the truth about the level of danger that they were heading into?
Complete. On a personal level, I grew up in the community, so I had a personal commitment to them as individuals. But as a leader, I knew that if I was not honest, if I was not straightforward, I put them in harm's way, and pretty quickly they would figure out that what I had told them was incorrect or at least understated. They'd lose faith in me.
Leaders, says General McChrystal, have got to stand up.
And what I mean by that is when it gets hard, when it gets morally questionable, when it gets physically dangerous, when it gets anything that tests the organization, the leader's got to stand up. Now that means the leader may get killed, may get criticized, may get removed, but that's the leader's job.
Father McShane has been at Fordham for more than 23 years. Inside the university church is a stained glass window depicting St. Aloysius Gonzaga, who died of a plague he contracted caring for one of its victims.
I walked past that stained glass window hundreds, probably thousands of times. And, I knew who was there, but it never caught me the way it did. I walked into the university church as the virus was taking hold of the city of New York, this invisible force. And I stood there transfixed, looking at this stained glass window that I had seen, but now I saw it. And I just stood there, and tears came.
Father McShane has been sending out weekly messages to the greater Fordham family in which he sometimes reveals his own sadness and his own fears. It was, I suggested, as though he was saying, I'm no different from the rest of you.
Ted, that's exactly right. I have the same joys and sorrows that they have, the same concerns, the same fears. And yet, in this very complicated moment of peril, but also of great goodness, there's great goodness that's showing itself now among the American people and people all over the world. Great heroism, great love.
Dr. Wheeler also finds a spark of hope glimmering within the pandemic. We're never really going to be quite the same after this, are we?
No, I don't think we're going to be quite the same. I wonder sometimes if maybe a new greatest generation will be born. That's my greatest hope, is that out of this and out of the collective we and what we will accomplish and go through together, that something new will be born, and that's hope renewed.